Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Acute suppurative thyroiditis. This is an acute thyroiditis, so it is a rare condition. It occurs mainly because of the suppurative infection of the thyroid. Whenever there is some infection of the thyroid which leads to pus formation, it results in suppurative thyroiditis. It is more commonly seen in the children and it is preceded by an upper respiratory tract infections or otitis media. Here, in acute suppurative thyroiditis, actually, if you see, normally itself, the thyroid gland is resistant to infection. Why is thyroid gland is resistant to infection? This is because of the excessive in thyroid gland is supplied by the sorry, thyroid gland has extensive blood supply and lymphoid tissue due to high iodine content and due to the fibrous capsule. Because of these conditions, the thyroid gland is inherently resistant to infection. Infection is not common in thyroid gland. But the infectious agents, what is the root of infection? If it is such resistant, then what is the root of infection for the acute suppurative uh, thyroiditis? Root of infections are, we have four different routes of infections. One, the infection can spread via the hematogenous route or lymphatic route. Why? Because the thyroid gland has extensive blood supply and extensive lymphatic supply, so the infection can travel via the hematogenous route and lymphatic route, or it can directly spread from this pyriform sinus fistula or thyroglossal duct cyst, which is important. So it can spread from persistent pyriform fistula or thyroglossal duct cyst. It can also come from a direct penetrating trauma, or it can occur due to immunosuppression. So whatever may be the reason, infection can occur in thyroid. And the causative organism in infection is streptococci, and anaerobes account for almost 70% of cases of streptococcal, sorry, 70% of cases of suppurative acute suppurative thyroiditis. Most common cause of this acute suppurative thyroiditis, or most common association, is presence of pyriform sinus, that is most commonly on the left side. And in these patients, actually, patients, if you see the risk factors, what are the risk factors of acute suppurative thyroiditis? The risk factors are long standing goiter or degeneration of the thyroid malignancy. Long standing goiter or degeneration in thyroid malignancy are the risk factors of acute suppurative thyroiditis in elderly. Then,
thank you and thank you for watching.